You know, we've had very unique opportunities to help educate our patients using superheroes. And to tell you the truth, they're not on my radar screen. I mean, now I know the kids that I see, they are on their radar screen. And it's not easy to explain the pathophysiology of a chronic illness like asthma to a child. And I mean, it's hard enough to explain to an adult, but then to a child to understand, well, why do I have to take this medicine over and over? And what does it mean? You know, you say I have inflammation in the airways. You know, they don't understand what that means. They know they can't, they're coughing, or they're having trouble breathing, or they can't go and play ball like their neighbors are, you know. So they need to understand this. And if we can use whatever tools it is, whether it's, you know, superheroes, then I'm for it. These are two of the superheroes who are in the comic books, the Medikidz, who, you know, who help us teach children about their asthma and their allergies.
I'm Cinderella.
And I'm Gastro.
Well, we take the kids on an adventure to Mediland. In Mediland, we can explain different things because the planet is actually shaped like the human body. So I am the bone and skin specialist, and I am able to turn into a skeleton to teach kids about the skin and bone system.
And my character teaches children about the gastrointestinal issue. So I know everything from the bum, the tongue, and all the tubing in between.
Well, the comic books really focus on initially the pathophysiology of asthma and what's going on in their body. And you know, the Medikidz superheroes take them in journeys. I mean, in allergy, it impacts the skin. You know, it impacts the GI tract. You know, and we can have reactions to that. And there are other superheroes as well, because there are superheroes that focus on the lung. So it's written by physicians, and then it's reviewed by specialists. And so we, as specialists, sometimes tweak some of the content to make sure it's accurate and really helpful for our patients to understand their problem, because these are tools. These are really teaching tools. And so that's really what we want, is an effective teaching tool that we can really feel assured that it's accurate and can really help our patients. My understanding is that even teenagers and young adults really get into comic books. So I think it's not just for the smaller, younger child who's maybe in school, you know, elementary school, but I mean, even older children, it can help them too. And, you know, the adult who's reading it can relate to it as well. So I think it can impact all ages. The funding has come from a pharmaceutical company, a very generous grant from Meta Pharmaceuticals, and the Medikidz organization is the group that puts together the initial content. And the college has been very happy to be able to partner for this asthma initiative in terms of taking care of how the Medikidz learn about their lungs and their asthma.